Johnson, and we got Bruce back here with us today. You remember his video I did a couple weeks ago where we found he had a severe scoliosis and a kyphosis in his spine, and at that time I suspected he had a condition known as Ankylosing spondylitis and did not adjust him the very first visit because I didn't want to do more harm than good. So we ordered some films on him. We got those back and the radiologist report back, and sure enough he does have severe ankylosing spondylitis, an advanced case of it, which is, I don't know if you can get up close on this, Joseph, it's also called bamboo spine. The spine ligaments all the way up and down actually calcify and fuse together the entire spine. I'm going to go back to a previous image I had here. See, you can see the calcification of the ligaments all the way down. It looks kind of like a cane pole, fishing pole, and fuses the interspinous ligaments, the anterior and posterior longitudinal ligaments. That's from the side view, which I'll show you here. Yep, see? So all this is fused anterior longitudinal ligament, posterior longitudinal ligament, and it takes on the characteristics of a bamboo shoot, bamboo spine, and that's exactly what this disease is called. Now, I also was going over with Bruce in private before we started this video that there may be some people that would go ahead and try to manipulate his spine or adjust him for whatever reason, but I'm not one of those people because I believe that adjusting his spine or manipulating his spine would cause more harm than good. So we're not just going to haul off and do the ring dinger on him for your amusement. We're going to do the right thing by him. And he also has some calcification in the carotid arteries that we found on the x-rays as well. So manipulating his cervical spine not only would be putting him at risk to be in a lot more pain, but also to have a stroke. So we don't want to do that. So I am going to show Bruce a couple little home exercises that he can do safely to keep him from kind of just letting his head hang down and let gravity keep pulling him down towards the earth. So let's go in the other room here, Bruce, and we'll show him that. And thanks again for allowing us to do this video.
Like that.
Here, let me get that chair. You can just sit that down right there. Yeah, you can just set that down right there. And we're going to stand up here in front of the mirror again. Okay. We didn't show you Bruce's actual x-rays because of the HIPAA laws. We don't want to show his vitals and information on there. Now come from the side view, Joseph, and take a look. See, I want to show the people. See, when he did flexion extension views on his cervical spine, he has absolutely no movement in the individual vertebrae of the cervical spine and thoracic spine, but it moves as a whole there. So, again, manipulating his spine would only cause him to have pain and possible breakage of that carotid artery atherosclerosis, which is plaquing in the arteries of the carotid arteries, and that could cause a stroke. So we're not going to do that. But I am going to show him a couple exercises, and Bruce, the first one is, I want you just to, with these muscles, lift your shoulders straight up, and then with these muscles, pull your shoulders back, flare your, nope, does these relax, flare your hands kind of like this. You see how that kind of tightens all this up? Now I want you to try to bring your head back as far as you can. I know that's going to be the hard part, so you might have to extend this way just a little bit. Now see, he's got so much fusion in his spine that even hurts him to do that. So I won't have him do that. So really the only thing that you need to do is pull your shoulders up and back and just try to keep your chin up as much as possible. That's the only thing that you can do on your own, and that's probably even going to create soreness.
But it might help.
But it will help you to keep from just having gravity pull you continually forward like this.
I feel like I'm going to fly.
There you go. But,
yeah.
You know, there's some patients that we accept, that we help, and I'll accept those patients and gladly work on them. However, there are certain cases that you just shouldn't accept because you can do the patient more harm than good. So we're going to do the right thing by Bruce, and we're going to just let him live his life. He's not having any pain. God has blessed him with no pain, even though he has this disease. So I don't want to mess up any of that. So Bruce, what would you share with our YouTube subscribers and fans about your experience here? And
I would tell you all that I trust this man, and a video of another patient brought me to him. And I've had this a long time, and I appreciate his honesty. That's the key thing, that he could do more damage to my body without me knowing about it, and the soreness I would feel would get worse. Yeah, I'm a mess, but God's on the throne, and he will take care of
Amen.
Gregory and me.
Amen.
I don't have any pain. I just came to try and get more flexibility, but now that I know,
that it could cause more harm. We don't want to do that.
I don't want to do that.
Yeah,
So
and
it's
I
not
won't
a
do
problem.
that either. And
I'll
I wouldn't
keep on
let
keeping on.
anybody else touch him either.
Ain't gonna
I've
happen.
already told him that.
Ain't gonna happen.
So this is your Houston chiropractor with a real life situation that you all need to pay attention to, because you don't want somebody just taking you in and snap, crackle, popping you for the money. You want somebody to give you the true facts of the matter of your health condition and treat you safely and effectively if they're going to treat you at all.
Amen. I
So
agree.
praise the Lord for that, and thank you for coming in and doing
Thank
this
you.
with us.
I appreciate it.
And this is your Houston chiropractor, Dr. Gregory Johnson at Advanced Chiropractic Relief. We'll see y'all next time.